Hello, my name is Ravi Vij. I'm from MyCancerHaven, and today in the Conversation with Cancer Expert series, we have Dr. Geoffrey Shouse, who's assistant professor in the Division of Lymphoma at the Department of Hematology and Hematopoietic Stem Cell Transplantation at the City of Hope in Duarte, California. And we're going to talk about a drug that has only recently come to the fore in the treatment of heme malignancies, Pirtobrutinib. So welcome, Geoffrey.
Thank you.
So, Geoffrey, just for the audience, can you give us a little primer on the role of BTK in hematological malignancies? And then we can obviously talk about where pirtobrutinib fits in.
Sure. So maybe starting from the top, we can kind of, looking at the diagram, see that the B cell receptor is kind of the primary start of the signaling cascade. And so we're talking about B cell malignancies here. And in B cell lymphomas, we have CLL, MCL, marginal zone, Waldenstrom's, among many others. But the importance of the B cell receptor is that it can drive growth signals and proliferation signals. And if those growth signals remain on and active, then you can get cancer. And one of the downstream molecules is the Bruton's tyrosine kinase. And there are situations where this molecule or upstream signaling pathways can become active and promote growth of these various lymphomas. And so when it was identified how important this particular molecule was to the growth of many of these B cell malignancies, it became a very attractive target for inhibition. And since then, we've identified multiple different inhibitors of BTK that have been very effective therapies that have kind of revolutionized the treatment of many of these cancers, not just because they work so well, but because they can also be given orally. Patients usually tolerate them pretty well, and their toxicity profiles are pretty well managed.
So you do mention that we've had now got a number of these BTK inhibitors. So just to put in perspective before we launch into pirtobrutinib, what has come before it?
Definitely. So the first generation covalent BTK inhibitor was ibrutinib. Very effective, does have some pretty significant toxicity, including bleeding toxicity, as well as cardiac arrhythmias, including atrial fibrillation, atrial flutter, and now in some of the more recent studies, even ventricular arrhythmias. Then second generation covalent BTK inhibitors have come out, which include acalabrutinib and zanubrutinib, and they're highly active.